Okay, hi everybody. Thank you for coming tonight. We're going to start off your evening with the mandatory trainings we need for family treatment. So we are going to discuss SIDS, sudden infant death syndrome, crib safety, bath safety, pediatric abuse and head trauma, also known as shaken baby syndrome. SIDS is the sudden death of an infant, which all other reasons for the death have been ruled out through autopsy, death scene investigation, and review of the medical history. A study, I should have put the date in here, I did for the clients, but found that bed sharing is a top risk factor for SIDS. Researchers found that almost 70% of infants in SIDS-related deaths were sleeping on adult bed or near another person. So that's a lot of the correlation between SIDS, or for SIDS. SIDS facts, the major cause of death. It's the major cause of death in infants after the first month of life. It claims the lives of over 7,000 American babies each year, so that's nearly one baby every hour of every day. SIDS victims appear to be healthy prior to death, so there wouldn't be really any indication that one baby would be at higher risk for SIDS than another. And there appears to be no suffering for the baby. The death occurs just very rapidly, usually during their sleep. So there really isn't any adequate medical explanation for what causes SIDS. Currently, the main theory includes that there's stress in a normal baby that can be caused by infection or any other factors. So a birth defect, often again, that's not something that we can actually see. Some studies are showing that there might be an underdevelopment of a part of the baby's brain that can only be seen through brain scans, and that's not something that babies are getting, often. So we wouldn't really know if that was something to consider or not. Failure to develop or thrive could be another indicator, and also they're seeing increased risks of SIDS during critical periods when babies are especially vulnerable. So during those times of rapid growth between those 2 and 4 months of age. Other statistics show that babies are at higher risk for SIDS during that 4 and 6 month age range as well, because that's when they're starting to move more. So trying to crawl or moving from their back sleeping position to rolling onto their stomach. So that can be another higher risk age frame. And then when they get older too, parents tend to think they're old enough for blankets or pillows, and so then we'll put those things in the crib, and then closer to 12 months, the higher risk of that would also be due to more things being put in the crib with the baby or that co-sleeping. So ways, like we were talking about, there's no specific cause for SIDS. We know what things are correlated with sudden infant death. And so based off of those correlations, there are preventative things you can do to try to reduce the risks of SIDS. So putting the child to lay on his or her back to sleep, to use a firm sleep surface. So even if you think, or a parent thinks that a firm sleeping mattress is fine because it's firm, it's not safe. So just because you have a firm mattress with a firm sheet or a tight sheet does not make the bed safe. Smoking during pregnancy or smoking around the child can also increase the risk of SIDS. It's recommended to have a separate but proximate sleeping environment. So for example, the reason why this is recommended is to have a crib or a bassinet or something like that in the same room as the parent, but not co-sleeping. The reason that this is being recommended is because they often know the parents are tired, and so it's easier for them to just fall back asleep with the baby in their bed than having to get up out of the room and go to another room. So if the safe sleep environment is closer to the parent or caregiver, then they're more likely to follow those safe sleep kind of rules. So that's another preventative tool, is to sleep closely but separately. Pacifiers during nap and bedtime can help strengthen the neck and the mouth muscles and things like that, to also help strengthen, to prevent any kind of difficulty with making sure that they're getting appropriate air to breathe. Avoid overheating. Avoid commercial devices marketed to reduce the risk of SIDS. So there might be things that say it reduces the risk, but again, because we don't know what causes it for sure, there's no way to actually say that this for sure can prevent it 100%. So the best thing to do is have nothing in the crib with the child, a pacifier, and a safe sleeping sack. Don't use monitors as a strategy to prevent SIDS, and also encouraging tummy time. So same idea, making stronger muscles in the neck and the shoulders, and all of that will help reduce any possible underdevelopment that might be a correlation with SIDS. Avoid having an infant spend excessive time in a car seat or carriers or bouncers. That sitting up position actually applies pressure to the baby. And so upright cuddle time should be encouraged. And I think I have, it's not in here. So it's called a proximal asphyxiation. When babies are up in an upright position like that for a long time, the pressure of their body in that sitting position can tire out their diaphragm, and so then they suffocate. So that's why we're, it's against our rules here for babies to be sleeping in anything but either in the mom's arms or the crib. So sleeping or being in that position too long can actually cause or be correlated with suffocation. So what does Wayside do to help prevent? We have sleep rules and policies in place that we also take from the Minnesota statutes. So infants must sleep on their back unless we have something from a doctor directing any other sleeping positions. So unless you see something in the client's file indicating that they don't have to sleep on their back or that they can sleep at an incline or something like that, babies need to be sleeping with nothing in their crib, nothing under the mattress, and sleeping on their back. However, once an infant can independently roll from their back to their stomach and from their stomach to their back, they may be allowed to stay on that sleeping position on their stomach. If the infant is at least 6 months old, or we have a signed statement from the parent indicating that the infant regularly rolls over. So family services counselors do have parents sign a document if they are stating that their child is able to do this physically, and staff don't need to wake them up to put the child back under their back. So as of right now, when staff are doing room checks at night, if they see a baby sleeping on their stomach, unless they know that that client has signed a document or there's a physician's order stating otherwise, our protocol is for staff to wake the client up to have the client place the baby back on its back to sleep. Nothing can be placed in the crib with the infant except for the infant's pacifier. A parent may place an infant who has not yet begun to roll over on its own into a one-piece sleep equipped with an attached system like this safe sleep sack. Once a baby can start rolling back and forth, then they can no longer have that swaddling piece on the sleep sack. So they do make sleep sacks without that swaddling device. So if you imagine a baby is able to turn, if they flip themselves under their stomach but they don't have their arms out, they can't push themselves to get back onto their back or to get their head out from a different position. So that's why once they start rolling and all of that, they cannot be in that swaddled safe sleep sack. But otherwise, safe sleep sacks without the swaddle are also approved, but no blankets, no loose blankets to create a swaddle are allowed. Just what this specifically states, which is it's an one-piece sleeper equipped with an attached system that fastens securely only across the upper torso with no constriction of the hips or legs to create a swaddle. If an infant falls asleep before being placed in a crib, we expect that the child be moved to their crib as soon as practicable, and to keep the infant within sight until the infant is placed in the crib. So with that being said, the way that this is taken is from, let's say you're doing room search or room checks, and you wake the mom up to put the baby back into the crib. You just want to make sure that you see that the child is placed into the crib. Or if a child fell asleep in the car seat, you know, it's gonna take some time for mom to go from downstairs to upstairs to put the child into the crib. So we just want to make sure that we're following up and making sure that the child is getting into that safe sleeping environment. We just want to make sure as well that babies are sleeping in a position that their airway is not blocked and that there's nothing covering the child's face. So sometimes parents might like to bundle the children up with blankets while they're holding them. And that's fine, and we want to make sure that those blankets aren't covering the child's face or the mom's not wearing something that can get in the way of the infant being able to breathe. So in general, where should babies sleep? In their own bed, in the crib, a pack and play, a playpen, a bassinet. They should not sleep in a parent's bed, car seat, baby carrier, water bed, sofa, floor. However, at Wayside specifically, they can only sleep in the cribs we provide or in the mom's arms. I will talk about it in a minute, but Wayside does monthly crib checks to make sure that the cribs are safe and not recalled, and that maintenance is done on the cribs if there are any concerns, and so that's what we're licensed for, are for our specific cribs. That's why we don't allow bassinets or things like that for them to play or to sleep in. We have a playpen in group. This is not for the child to sleep in. This is for when we have older kids that are playing and they're in group with mom. So to specify, you shouldn't be seeing babies sleep in the playpen. So what should be in the sleeping area? Your baby, and that is it. So although plenty of places sell bumper pads, beautiful blankets and quilts and decorations for nurseries, none of that should be in the crib. And crib slots should be no wider than 2 3/8 apart, which all of our cribs meet those requirements. Also, I think I might say it later, but I will make sure I say it now in case it's not in the slides. When we do room checks, we need to make sure that there's nothing in the child's crib during that time either. So even if a child isn't living on site, but the mom has a crib in her room, there should be nothing in that crib, just the crib sheet. Sometimes clients like to put blankets in there or use it as extra storage space. And licensing requires that we have nothing in those cribs, even if the child's not living on site. So again, making sure that the baby is being placed onto their back. Do not put the baby on its side to sleep. Do not prop the child. Don't overdress the child. Babies are comfortable between 61 and 67 degrees, and that seems kind of cold. And that's typically a pretty comfortable temperature for them. Wayside does have safe sleep sacks for parents to borrow, and family service counselors and now treatment assistants can help clients find resources to get their own safe sleep sacks to sleep with. So if they're concerned that their baby is cold, they can wear long sleeved pajamas that have footies on them or extra socks, things like that, but no blankets. No stuffed animals, so nothing. Babies need to sleep in their own crib and not in a client's bed. Here are our main Ripple rules, again, as a way for Wayside to support clients in preventing any kind of sleep-related concerns or habits. Children must be supervised by their parent at all times. That means that even though a client has a monitor, they still need to be checking on their children every 30 minutes physically. So even though they have the monitor and baby's asleep, they're still going up there every 30 minutes to check on the child with their own eyes. We have also our Ripple rule about not co-sleeping and that the child needs to be sleeping separately. And that children may not be sleeping in car seats or carriers. you have more questions specifically on safe sleeping practices, you can review the American Pediatrics Association safe sleeping practices that they have. And it says parenting worker on here, but we're not parenting workers anymore. You can always check in with the family services counseling staff here at Wayside as well. Failure to comply with safe sleep. So if an infant or child falls asleep before being placed in a crib, like I mentioned before, staff is going to ask the client to place their baby in the crib. And then staff need to make sure that the child is back in a safe sleeping position before they leave the client's room. So that's most important for staff that does overnight shifts who are doing room checks to make sure that the children are sleeping in a safe environment, which is their crib, and that you're not leaving their room until the child is safely back in their crib. If you notice a pattern and you have a concern that, okay, client is putting their baby down in the crib, but I walk away and then they put the baby back in the bed, then we do ask you to go ahead and keep checking in on them every so often to make sure that the child is indeed in a safe sleeping environment, which is their crib. Sometimes staff ask, well, what if they were co-sleeping then, but mom wakes up to nurse or to feed the baby? Do I have to stand in there that whole entire time? I think that's fine. If they're actually going to, feed them, then go back again in about 15-20 minutes and make sure that the baby has been put in the crib. So mom, in general, with like our co-sleeping stuff, parents can't cuddle with their babies, like if they're sitting in bed holding a baby, but babies cannot be sleeping on the mattress even if the mom's awake. Okay, so baby can only be sleeping in mom's arms or in the crib. But if they're snuggling, or even with a 3-year-old, they're snuggling in bed before nighttime, they can snuggle in bed. It's just that mom needs to be awake, and that once the child's asleep, that they're in their own safe sleeping environments. Call on call when necessary. So if a client is refusing to follow safe sleep practices, then you can call on-call clinical staff, and we will work with the client on de-escalating. Please chart every instance that safe sleep is not being followed. Our staff, our family services counselors, have 7 days from the incident to follow up with the client, in which we are reviewing SIDS with them, how to prevent SIDS, and how to practice safe sleep behaviors. So every single time a client co-sleeps or doesn't follow a safe sleep rule or policy, then we have to review it with them and come up with a plan to prevent co-sleeping or safe hazards in the future. Depending on the situation of the client, collaterals may be contacted regarding the failure to follow safe sleep. That's something that the family services counselor would do. That's not something RA staff would need to do. But just know that those are things that our staff would be following up on. If failure to follow the safe sleep policy is endangering a child, concerns of abuse or neglect are occurring, again, you are a mandated reporter, and so you can make a report. And co-sleeping on its own is not a mandated report necessarily, but if there's enough concerns that baby is already having a lot of other health issues, and there's enough indication there to feel like there is a neglect or abuse type of thing happening because of the co-sleeping, you can always make a report, and you can follow up on that. Any questions specific to SIDS or our policies at Wayside regarding safe sleep? Crib safety, so like I mentioned, our family services counselor staff monthly check all of the cribs. Sometimes we do that with clients present to teach them also how to make sure that their crib is safe, so that they know that skill when they leave Wayside. We want to make sure that the mattresses cannot be easily dislodged from any point of the crib. We make sure that there's no screws or bolts or hardware that is loose or not secured. We check the crib to make sure that there are no sharp edges or rough surfaces that could injure somebody. For instance, like having splintered wood We want to make sure that the wood is also not split or cracked. We want to make sure that there's no unacceptable gaps between the mattress and the crib slot. So there's a certain amount, and we check to make sure that's not happening. That there are no crib slots that are further than 1/3 inch apart, which none of our cribs are, so we're meeting that standard. We check to make sure that there's no recall on the crib. Each crib needs to have a fitted crib sheet. And again, cribs must be empty if a child is not currently sleeping in it, but even if a child's sleeping in it, has nothing in there but the baby. Once a child turns 12 months or is older, at that point, then they can have, from our licensing, they can have blankets and pillows and stuff in the crib. And there are other things in general that you want to make sure babies can do developmentally to be safe with a blanket or pillow. So, for example, you might have a 12-month-old, but maybe developmentally, physically, they're not kind of to those places that a pillow would still be safe. And so that's something family services counseling staff would make you aware of or talk with the client about. But in general, 12 months they can start having those things. Questions on crib safety? If you as a staff member notice any concerns, also please make a maintenance request as soon as possible and notify staff to get that done. What we often see will be a new admit will move in for a crib, but it's like a 2-year-old and the crib mattress is really high, and so they could like pull themselves and crawl over the mattress. That's dangerous, so we would want to make sure that gets changed immediately with the maintenance person to come and fix that. So that's oftentimes something that we would see is like if a baby, just the setting, because the cribs can be turned into toddler beds, so the height of the mattress can be like high, mid, and low. So if it's too high and the baby is one that can pull itself up and crawl out, we just want to make sure that those mattresses are low enough. I'm trying to think of any other common things. But yeah, so if you hear any clients having any concerns with their cribs, please let us know immediately. But also making sure maintenance is notified right away. Bat safety. So from Minnesota Department of Human Services, never leave a child or infant alone around water, not even for a few seconds. Don't put an infant into a tub when the water is still running. The water temperature could change or the water could get too deep. And for our pipes and things here for our water system, sometimes it can get really cold and really hot with their weather changing. So we also want to make sure that the child is not being exposed to a temperature that could be harmful to them. For infants, they only need about 2 to 4 inches of water. So these are things that each client is reviewed, or we review with them at admin and ongoingly throughout their stay here. In terms of us, we just want to make sure if we're walking through the hallways and we like see a mom running from the bathroom to the room and like where's your child, like making sure that child is not being left unattended for water. Also, something else that we talk to with clients about is if they're taking any medications that can cause drowsiness, we want to make sure that if they are experiencing any of those symptoms, not to bathe their child. So let's say they take a medication in the evening that makes them drowsy, and then their baby wakes up with a big blowout diaper, and we ask clients to seek out staff support to help either do a sponge bath or something else to clean the child, but not exposing that child to being around water when mom is not able or the parent isn't able to really be as present as she might be if she wasn't under any other medications. So we do want to be mindful of that. So if you are seeing clients that seem overly drowsy or anything like that, in general, please follow up with them, contact on-call clinical or if anyone's on site to also assess them. Because in general, we always want to make sure that children are being able to be properly supervised. Pediatric abusive head trauma. Oh, sorry. Any other questions on bath safety? Wayside has purchased in the past those like little rubber duckies that go over the bath spout as well, just so the kids aren't hitting their head on the bath spout. So if clients ask about those sort of things that Wayside does also provide to help make sure that they won't hit their head on that. So pediatric abusive head trauma, also known as shaken baby syndrome, what is it? It's a serious brain injury that happens when an adult, and I would even say young children could cause this to other young children, violently shakes a baby or young child. So specifically, this is when a child's head is shaken back and forth. Their brain hits against the skull, which causes bruising, swelling, pressure, and bleeding in and around the brain. A child with a pediatric abusive head trauma may also have damage to the spinal cord or neck. Also may get bone fractures. The amount of damage depends on for how long and how hard a child is shaken for. But about 5 to 10 seconds, a child can suffer permanent severe damage or even death. With the clients, I show videos to each of these topics. If you are wanting to watch videos, I certainly can send them to you. It really does not take much to cause damage to a child's brain or spinal cord or neck. So we encourage, when clients admit, each client fills out or completes an emergency plan for the children. We discuss with them pediatric abusive head trauma. We assess to see if they are at higher risk to have any type of pediatric abusive head trauma risks to their child, and talk to them about if they're feeling overly angry, frustrated, tired, whatever, to put their child in a safe environment like their crib, and then come and get staff immediately. And then at that time we would use that child emergency plan to get the children to be picked up. The main reason this occurs is because a caregiver is upset or frustrated, maybe overly tired themselves as well. Most shaken baby injuries happen to children under the age of 2 years old. However, it can show up to children up as old as age 5. The average age is between 6 and 9 months that we see pediatric abusive head trauma. There are 1,200 to 1,400 cases of shaken baby syndrome in the United States every year. 1 out of 4 of these children die, and only about a third will survive without any severe disabilities. Boy children are shaken more often than girls, and almost 80% of the perpetrators are male. So what can happen to a child who is shaken? Eye damage or blindness, hearing impairment, speech disabilities, damage to the neck and spine, learning disorders, behavioral problems, permanent vegetative states, developmental problems, seizures, paralysis, and death. So remember when we said up to 5 to 10 seconds? And it could even be less than that, that can cause a lot of stuff. So this picture, as sad as it is, I think it's a helpful thing to see in terms of if we're trying to assess if maybe a child has been shaken. The eyes are puffy, almost looking like maybe a black eye or puffiness. What happens when a child is shaken is that the retina and all these other pieces of the eye detach from the part that connects to the brain. And so then that's what's going to cause the bleeding and the swelling. Also, you can see the baby's lip is kind of to our right, almost like you might see in a stroke victim. And so if you see a child with some of these types of things where there's that swelling, they're not seemingly to be in their typical state, that might be some red flags or some indicators that maybe they've experienced some abusive head trauma. Abusive head trauma does not happen with gentle shaking, or not shaking I should say, but gentle rocking or playing, where a baby's head might be bobbing a little bit. This is more like where their head is actually, it's kind of like that whiplash kind of thing, where their head is actually kind of rolling really back and forth. But gentle play or rocking, that isn't going to cause the abusive head trauma, but more rigorous shaking will. So again, if you're noticing parents that might not have a really secure hold on their children, like holding their neck well to help their keep their head